My name is Alexandre Alaphilippe. I work as Executive Director at the NGO EU DisinfoLab, which is an organization studying exposing disinformation in the European Union. And during the last month, the EU DisinfoLab has conducted a monitoring of disinformation related to COVID-19 and other topics related to the infodemic that we witnessed in the past month. In the past month in Europe and in the world, we've been hearing a lot this new word, infodemic. What is an infodemic and how is it linked to a pandemic? Infodemic is a kind of a neologism, a new word that has been brought up by the World Health Organization, the WHO, to explain how when you have a pandemic, when you have a new disease which is circulating in the world where you have so few knowledge about what it is, how it gets transmitted to people, how it circulates, you have a vacuum of information. And this vacuum of information is not filled and actually fueled by the fear, the anxiety. Will I get this new disease? Will my family get this disease? What are the risks for me? And this generates a vast amount of conversations. Physical conversation with your family when you have them on the phone, but also in the digital world. And that creates a lot of content which is completely unprecedented. There is no history of what's about the COVID-19. So what is the asymmetry of information? When a new virus, when a new disease starts, we have actually very few knowledge about it. So the asymmetry of information means first that people are willing to have information and there is none. There is a vacuum of information. So basically, if you search for how will I get the COVID-19 in January 2019, you have very few information. And actually, because you have very few knowledge, scientific knowledge, because it takes time, journalism, reporting, health specialists, because we don't have enough time to study that new matter, actually only the people who are doing false information or very partial information will be present online. So the asymmetry of information makes that if you search for something that does not exist, then you might find more disinformation than actual information, and you might be more reluctant then to believe actual information because you've already exposed this information before. And we could see, for instance, that this circulation has been has lived through different phases. We could see, for instance, that all the disinformation we observed at the EU DisinfoLab was very different from when the outbreak started in China, from where we had COVID-19 in our communities. So when the outbreak started in China, we had a focus on the situation there, what's going on, what's the truth, either there were like international conspiracy theories, already false cures, like how to protect yourself from COVID when it will come. And the whole disinformation at that time was very much focused on what was happening in China. When we started to see that the disease was circulating in other countries, we had a totally new phase of disinformation when we had very different narratives. We had more things linked to panic, like do you need to stock toilet paper, do you need to stock water, food, and the kind of panic that ran down to the supermarkets. We also had a new verge of false cases. So people saying that there are new cases happening here and there, which were not proven at all, and just was used as a content to actually create panic and anxiety, because then you have the impression that the disease is getting closer to you. So we could monitor very closely that these different phases happen in various European countries at the same time. And what is very interesting, it shows that disinformation travels also in many European countries at the same time with similar narratives. So which really calls to have a European point of view on these questions, because it's not only about me, it's about us as a community and how we're exposed to disinformation the same way, with local and cultural adaptation, of course, but the same way than other European citizens. And this pandemic has really revealed this in a very unprecedented way. What we've seen already is that the amount of disinformation to check for newsrooms, for journalists, for fact checkers, for organizations like ours was enormous. We spent a lot of time outside our working hours just trying to help people to know what was going on and how they were tricked or duped or lied to online. And this goes with risks for organizations, especially small organizations with risk of burnouts or exhaustion. So I think what we will be needed in the future was to have more people doing this, more small organizations, more people that are able to understand what's going on and to pass the message and to be able to support the work of others. We need to respond as a closer community, also between countries, because as I said, we could see the same narratives in different countries. So we have to work more together on ourselves. We need to have more initiatives fighting disinformation. So what can we do as individuals? I think it's very simple. We need, every time we see something which makes us angry, which makes us sad, which makes us very happy also, is trying to understand why we're exposed to this content, whether it's information or disinformation. We have to understand that there are algorithms that are playing a role in recommending content to us. We need to understand that people can hide behind false Facebook pages or false Facebook groups. We have to understand, like, we have people that can hide behind Twitter accounts or even Snapchat accounts. So what do we need to do is to make sure that before resharing something, we take 30 seconds to understand why we are exposed to this. How did we receive this? Do we receive this from someone we know? Did we receive this from someone we trust on that specific topic? Did we read the article? Did we check the article was actually a real article from a real newspaper or a reputable source? And then, if we agree with this, if we are very comfortable with the content that we've seen, only then do we share it.